I'm talking about the benefits of yoga in people with multiple sclerosis with a yoga colleague of mine, Mindy Eisenberg, who is from Michigan. I have a nonprofit teaching yoga to people with MS, and we teach a really powerful yoga class that's based on the Baptiste Power Yoga methodology, which traditionally is hot yoga, but of course in MS we don't teach hot yoga. We don't teach in a hot room, we cool the room. And we come from assuming that there is no disability, even though that's false, right? So there are people in the class who are in wheelchairs, there are people who are using canes, there are people in the class who are who look like they don't have multiple sclerosis. And we learned from a really great gentleman named Matt Sanford, who is a paraplegic who teaches yoga and practices yoga, that if you assume that people can't do things, then they'll never try. So we say things like press your feet into the mat, even when people can't press their feet into the mat. And lo and behold, they're pressing their feet into the mat. So really cool things happen in class. And we use a lot of modifications and adaptations with bolsters and blocks and straps, and we help people get into things that they couldn't do themselves. We have assistants in class, and they help as well. So it's not. So for me, it's easy to say, because in Jacksonville, where we started, I would say about 50 to 75% of our people in our yoga classes are patients of mine. So I very much know their capabilities, and I feel comfortable with what they can and can't do. However, what we've learned from teaching is that these people know their bodies really, really well. And accidents do happen, and they have happened, but we teach from a very safe place. And it's one of the reasons why we've stayed true to the Baptiste methodology, because of the way we teach a pose and get a person into a pose. It all comes from core integration, so we protect the lower back, and we're careful with the modifications that we use. Currently, we have some very experienced teachers working with us. In Jacksonville, we have 3 classes. In Charleston, we have 1. And in Philadelphia, we have 1 that's about to be 4. And our teachers have to be at least 200-hour registered yoga teachers. Our teacher in Philadelphia is an experienced RYT 500, which means she's been through 500 hours of teacher training, and the E in front of her name means she's taught over 1,000 hours, which is a lot of yoga to teach. And we also have developed a small training module on multiple sclerosis and how it's different teaching yoga to people with multiple sclerosis, what the disease is, what the symptoms are, what they may or may not see in class, what they need to speak to make sure people stay healthy and hydrated. We do things a little bit differently from Mindy, who teaches in Michigan. She teaches a different style of yoga that's a bit more adaptive than we teach, and she has more teachers and assistants in each class. But we're both doing really great work with, they love it, with our people, our MS yogis. It's for anybody. So really, yoga is for everybody. So one of the things that was just really presents me to the fact that it was for everybody is we had a woman coming to our class for a while who was wheelchair bound, and by the time she stopped coming to class, she had basically movement of her head and very little movement of her arms anymore. And her care partner would move her, and we would help move her, but we would just assist her with spinal alignment, with moving her arms and bringing her shoulder blades down, and her breathing would change and she would sigh with relief. And so we know that even though she's not moving to the extent that you or I could move, or that someone else in the class could move, she was still getting benefit from being in a community of people, and also learning the breathing techniques that you can take anywhere. When we've surveyed our students in Jacksonville, they say that they've had an improvement in anxiety, that they've learned how to breathe, that they feel that their balance is better, and they feel a little bit stronger. The small amount of research that we have in yoga and multiple sclerosis tells us that there is betterment in bladder function, betterment in fatigue and mood, betterment in balance and spasticity and pain. And they're small studies that are, I think we're going to see the body of yoga literature and the benefits in MS grow in the next few years. In my everyday job, part of my prescription for a healthy living plan for people with multiple sclerosis is exercise. And we speak about what that exercise looks like for them, and what their level of ability is and what they enjoy doing, who they enjoy doing it with. And I do usually recommend yoga from the standpoint of the physical benefits and also the psychological, mental benefits of it. And whether they come or not is up to them. We also, in many cities, they're doing Tai Chi in multiple sclerosis centers, and then other types of exercise programs, because we know that exercise is important for people with MS. So it's a part of my treatment plan. Exercise in general, I think in the past couple of years has become part of the treatment picture. Yoga in general is something that I do believe that physicians are becoming more open to. I think that one of the things that we address in our teaching about yoga and multiple sclerosis is something that you picked up on right off the bat, is this sounds like it's not safe. And so what we find is that holds a lot of people back. Even physicians from referring, or rehab professionals from referring, saying, who's your teacher, what are their credentials, that sort of thing. And it's the biggest thing that we face in people living with multiple sclerosis. It's, the second sentence that they usually say after they're diagnosed is how long till I'm in a wheelchair? There's so much fear and uncertainty involved in the disease that we actually try to use yoga as the place where that doesn't happen. I think that with more education about the tools that we're using to make it a safe environment, but also one that empowers people and inspires them to do things they had no clue they could do, that it will become more widespread.